It was really a game-changing way of looking at the world very differently.
We touch lives of people in different manner.
For public health reasons, everybody's health matters, whether they're your employee or not.
Helping people digitize a lot of the back end.
To delegate, you have to empower much more. Hi, my name is Nadia Wan. I'm the Group CEO for TMC Life Sciences Berhad and also the CEO for Thomson Hospital Kota Damansara. Basically run a listed healthcare company that is owning businesses in hospitals, IVF clinics, TCM, which is traditional Chinese medicine, and also retail pharmacies.
My name is Cherry Bay. I'm the founder and CEO of Bookdog. The Bookdog is a digital healthcare company, and we are operating in 5 countries and 20 cities, namely Malaysia, Singapore, Hong Kong, Thailand, and Indonesia. I miss meeting very interesting people globally, because when I travel, I meet a lot of interesting people globally.
I miss being able to go to museums and the MPO. I was, yes, I did learn how to bake traditional kueh, because that was something that I missed and usually would just buy and never thought that I would have to make it myself.
I picked up new sports called tennis. Oops.
Patient safety was a key priority here because we were dealing with a virus that was unknown to the world and there was a lot of information that was flying and I think the whole thing about the pandemic was how fast things were changing. And so I think what we had to do was really think innovatively about how we would deal with all these changes at the same time always ensuring that the safety of our patients and employees remained a priority. When I first heard about the news, I was actually in December, I was on holiday in Italy actually, and I was dealing with reviewing all of the new procedures, policies. A lot of decisions had to be made on the fly. How do you run a hospital from afar? And that was something that we had to really give a lot of thought about. It was really a game-changing way of looking at the world very differently.
So the pandemic, a few things, you break into a few segments. So the number one segment is, of course, our workforce, how we are considered essential, so all my staff still go back to work as usual. But they were worried, so we have to reassure them that there's no issue, number one. Number two, we also realized a lot of people, the medical tourists that normally will fly over, now we use digital. So they can still chat with the doctor, but digitally, so they can be in Indonesia, in Thailand, in Europe, they can still talk to the doctors.
I think we had a lot of people look for distance solutions. Definitely for international patients, we had people who were interested in teleconsults. You know, what we did at the hospital with the drive-through COVID tests, we even had drive-through blood tests, we had drive-through vaccinations. People were suddenly very worried about being together in a crowd of people. And I think, yes, that was where digital really came in to sort of allow us to control the crowds and to give people that sense of distance, which equated to a sense of safety for them. I think it sort of reinforced my own values and principles more. For example, I think with the pandemic, for public health reasons, everybody's health matters, whether they're your employee or not, whether they're the outsourced housekeeper or the security guard or your own staff in the hospital. And so what we did was that we offered free care for those people, even though they weren't our employees, because their safety actually meant the safety of ourselves as well. So I think there was definitely more empathy, there was definitely more of an awareness about healthcare as a universal right and a value. And I think the second way in which leadership changed was that you have to let go a little bit. Because things change so fast, you can't be the person who's making all the decisions all the time. You have to delegate, you have to empower much more. And I think that probably the team came out a lot better for that because I think that they could see that they could handle the crisis.
Our team also multitask and do a lot of things to reach out to the public, and we work with the Ministry of Health on a lot of things. For example, the lab Uberization. We also have daily webinar where doctors of MOH will come in and talk from 12 to 12:30 on health-related matters, mental, food intake, etc. We digitize all the public clinics. So before you walk into any clinic kesihatan, you must use BookDoc to book, and we have 600 locations on our platform.
When COVID hit, we obviously had to really look at cost optimization, and a lot of things had to be cancelled. But I think what's important is the sense that the organization feels that you're in it with them, and so that they understand the issues and the reasons why you're making tough decisions. And if everyone is on board with your mission, then they should be together with you and you should be together with them. But I think that managing the people part was most important at the end of the day, because they can make or break the success or failure of an initiative.
When you make a decision, say you got 100 staff, you rather have the pay cut for the 100 staff versus that you don't cut your company's sustainability is another run rate of 3 months or 6 months, and the whole company will disappear. The whole 100 employees will be jobless. So for my case, like initially I'd say we cut, but after that only the first 2 months. But the business boom, and subsequently what happened now, all my staff are getting 6 months to 2 years bonuses, even in this pandemic environment. During the toughest time, then when the employer come out and say, hey, we do well, despite the macroeconomic factors, the headwind is against you, we will do our best to help you, and this is what we did.
Being here for the long run. This is where I think values become really important, because in an ever-changing world, I think values are something that at least shouldn't change. So I think that when it comes to sustainability, is like really going back to your core value and purpose and ensuring that your organization sticks to that.
Sustain your workforce, sustain your customer service, sustain your technology that you're always the forefront. So all this I would define as sustainability. But to go there, the leader must be very strong. He or she must be a visionary who points them to the right direction. If he's pointing to the wrong direction, then people always confuse progress and movement. They're still going through the same round, but they're not hitting out to go to the right direction.
Chevy, and actually a lot of people out there would realize about healthcare, is that we are focusing a lot on the B2C aspect of it, like us serving patients, but there's actually a lot of opportunity for improvement in efficiency and optimization in the B2B section, because hospitals deal a lot with a lot of different types of inventory. We have a lot of back-end processes that are actually not very optimized, not very technology enabled, and I think that that's one area that somebody should definitely look into and help us, tackle that challenge.
So our business is to connect and unite patient and healthcare provider anytime, anywhere, right? So I want the misconception of we are just another digital platform who just pre-populate everything there, when real and fake doctors are also in there. So we don't allow that to happen, number one. Number two, our reach also is, we started as a B2C. Now our core business is B2B and B2G. That's why we can be profitable. And at the same time, I'm helping people digitize a lot of the back end. So one is the reaching out. The second part is automating a lot of the back end, the data, the statistics, the AI, the sample size, what they should do with the data to have more personalized and precision medicine. What I like about the hospital is the tertiary and quaternary care. By hook or by crook, you need the sick medical treatment there. Primary, secondary less, but a lot of hospitals still also do like a health screening. So I think as a hospital, you should still focus 80-90% on the tertiary quaternary care, number one. Number two, what I like is you can expand, which you expanded recently. I heard your second wing, but being a brick and mortar, there are limitations. That's why I was trying to work with you as an aggregator, as a technology enabler to reach out to a bigger market. So your channel is what you call, you have omnipresence.
What I like about technology is that the reach, the scalability, and also the transparency and the insights that the data that you collect can give. Because I think that without technology makes it a lot easier for us to understand our customers, to see patterns that perhaps may be hidden if we had not collected those data. But of course, there's always PDPA concerns. We're very aware of that. But I think there's so much that we can do if we just really use technology to really understand our customers so that we can innovate the way we deliver our services and products.
Think of them, they are Mandarin Oriental Shangri-La. I'm Agoda and Travago.